Hello, viewers. Welcome back to our YouTube channel. And just like my face has not changed, my name too has not changed. So it's still Mercy, your developmental disability expert. And today I want to give you a little information about parental involvement in therapeutic intervention. Will I say the benefit of it? Yes, there's definitely a benefit when parents play active role in the therapeutic involvement of their child. So, in the real sense, what does parental involvement in therapeutic intervention mean? It simply means that parents, caregiver, or family members playing active role, active, not passive, active role in the therapeutic intervention of their child or their word or their family members. When a child is being diagnosed with having one learning or developmental disability, I know that it can be very, very devastating. At that point in time, a lot of things is running down your mind. But I want to tell you one of the best strategies that can help to snap out the child from that condition or help the child to make maximum progress, especially for those who were diagnosed at the early years from 1 to 5 years and parents are involved. You start intervention, parents are involved, you keep pushing, using all the strategies that are being sold to you from the therapist, then you see the child blossom. I've been in this profession for over 12 years, and parents who are very much involved in trying to understand the state of the child, the assessment, right from when the assessment is done, they read the assessment report being sent to them, because sometimes when assessment is done and the report is being sent to parents, they don't read it. Some of them don't read it. They'll just leave it there in their mails. But when you study the assessment report, that sounds like the baseline for the child. So you know this is where my child is. Coming for IEP meetings, for the development of the IEP, the goals being set, all the strategies being placed to tell you, okay, this is what we want to achieve with your child for the next 1 year. You are involved. So you know what this therapist or what the company is doing for the child for the next 1 year. Down to the weekly reports from the booklet, and you are being told, okay, giving a task on a weekly basis, this is what we are working on, please do this, do that. That is the therapist selling the strategies to you. Okay, for this week we are working on this, follow on, and you implementing that strategy, you'll be able to know whether your child is carrying out those tasks as it ought to be. Don't forget that the therapist is also doing that. So there's feedback from you, there's feedback from the therapist, and this feedback are supposed to be on the same level. Or maybe there's a certain effect. Maybe the child is responding more to the therapist, or the child is responding more to you. So you come together with the therapist, you share feedback, and then you improve on the work. You see that the child will have a more supportive environment that will engineer maximum progress. So the involvement of parents in therapy intervention or therapeutic intervention can never be overemphasized. So when I get to see parents who maybe they feel that, oh, I have done the payment, do your magic, oh, they don't even know the state of the child, you see that there's a lot of struggle from the therapist and trying to sell idea. They take weekly tasks, they are not bringing it back home. You see past months, the tasks are not done. How do you want to make maximum progress with that session? I know that you as a therapist, you're seeing this video. I would like you to share your struggles too when it comes to therapeutic intervention and parental involvement. You can put in the comment section. Let's share ideas. If you have a better idea on how we can make parents to be more involved, please do not forget to share as well. So I will go on to say parental involvement in therapy intervention is very, very important because it helps the child to make maximum progress. It helps the therapist and the parents to understand the strategies, and both of them implementing it from the home angle and from the therapist angle, they make maximum effect and outcome from the child. And you see that the child will understand that, oh, it's the same thing everywhere I go. When I get to the house, it's the same thing. When I get to the center or to the school, it's the same thing. The strategies are being shared and everybody understands that and is running with the vision. Because some of these children are very, very smart. They understand that when they come to school, there are boundaries. So there are certain behaviors they are not allowed to exhibit. But when they get home, you see them exhibiting this behavior to the peak. So the parents are like, oh, you say my child can sit still in class, but I'm not seeing it at home. Because the child has understood that you didn't create that boundary at home. You didn't create it at home. And when the therapist is telling you, oh ma, this is how I'm going about it in school, or this is how I'm going about it in the therapy center, kindly do same at home. You think it's too taxing to do. You might not have all that patience, but I tell you, you just have to try. Do it with joy. So let's be involved. Let's be actively involved in the therapeutic intervention of our child, no matter the age. No matter the age. As this will help us to make maximum progress. Are you looking for maximum progress with your child? Have it at the back of your mind that you cannot do therapy intervention without being involved. As a parent, as a caregiver, or as a family member, do not forget to like, share, and subscribe if you are yet to do so. Please click the notification button so you'll be aware to be informed when our next video drops. Thank you.